Welcome, Adam, to the Biohacker Babes podcast. Thanks for joining us today in your morning. You're on the other side of the world. How are you?
I'm very good. Thanks, Lauren. Thanks, Renee. Thanks for having me on. I'm glad to be here.
Yeah, we've been excited to talk about this. Just as a little kickstart, Renee and I have both had some chronic aches and pains for a long time from our years from dancing, right? We had a lot of stress and wear and tear on the body. But the first time that we got to work with you guys with Wasabi Method, like we both experienced pretty much instant relief.
Mm.
And, there's been some waves since then, but I've never experienced immediate kind of gratification from tissue work before, which is really awesome. So, one, I just want to say thank you.
You're welcome. My pleasure.
But two, I think to say that it's the magic really was two part. It was practitioner driven because you guys are incredible, but also we have this amazing healing technology, which we're going to do a deep dive on today.
Yeah. hmm
I think I would love to maybe just kick it off with when it comes to pain for people that are walking around with chronic pain, what are
hmm
we generally globally missing when it comes to finding relief?
Well, that's a big question. It's a good question. So what I like to kind of reframe things for people because a lot of my patients and clients when they come to me, they've been indoctrinated in this kind of Western approach where pain is bad and pain's the enemy and we have to, treat the pain. Okay. So I reframe that from a different standpoint, like pain is good. Okay. Pain is a signal. All right. It's like a baby. I always use the baby analogy. Okay. If a baby's crying, there's a reason. Okay. So if we're saying the crying baby's pain, your body's in pain, it's crying out for saying, something's wrong, please help me. When we take painkillers or injections that get rid of the pain, that is literally the equivalent of taking duct tape and taping that baby's mouth and going, problem
Oh,
solved. Look at that. No more crying,
peace and
right?
quiet. Well,
Nice and
when you put
quiet.
it like that, that's pretty
But that's
inhumane.
literally what you're doing. You're telling the
Yeah.
body, shut up.
Yeah.
I don't want to hear from you.
I don't have
Okay.
time to deal with you.
I don't have time for that. Like we even have
Yeah.
commercials here in Australia. It's like, don't let pain get in the way. And it's like, there's a reason.
Mm-hmm.
Your body's trying to help you. So I tell people, I reframe it. Pain is good. It's telling you something's wrong. It's like the engine light in the car going on. It's telling you, go to the mechanic before you end up broken down on the side of the road. Okay. So when you look at it like that, like pain, you still have to deal. I still deal with people's pain. Because if I tell people, look, I'm going to treat the cause and I don't care about your pain, they're not going to come back and see me, right?
Right.
Because the pain's a great motivator. People like, that's why people half the time come and see me, right?
hmm
Aren't
hmm
going to spend their hard-earned money to see someone like me if they don't have to, right? Well, most people, but people like us who know the benefits of getting regular therapy and treatment think differently. But going back to the pain thing, we do address the pain, but it's not my primary focus. So I wrote a book 10 years ago on back pain, and in the title I have treat the cause, not the symptom. Unfortunately, in Western medicine, we've got stuck on treating the symptom because the patient goes, I'm in pain, it really hurts, make the pain go away. When when someone comes to me like that, my brain goes to, why is your elbow sore? You got two elbows. Why is this elbow not sore? Because some people come up with, they go, oh, it's old age or, it's something I ate or whatever. And I just dismantle their arguments. I go, well, this elbow is just as old as that one, right? And I'm like, well, if you ate something last night, it would have a systemic effect, right? Renee, you know about this from your nutrition. Like it doesn't just pick out one
Yeah.
elbow and make it way worse. So often it's biomechanics. So my job as a sports chiropractor is I have to figure out one thing. Is it musculoskeletal or is it a type O, which means organ related? which means, it's like a disease or, something else that is not musculoskeletal. That's my job. So
Mm.
I go, is it musculoskeletal? Yes or no? If it is, I treat it. If it's not, I refer. Okay. Unfortunately, a lot of practitioners don't do that. They don't, they try and a lot of practitioners try and delve into other things. And you can do that, but you have to have the knowledge to do so. You have to have wisdom. And I always tell people wisdom is two things. It's the combination of knowledge plus experience, right? I could read every cookbook in the world and have knowledge, but I don't have wisdom on how to be a three-star Michelin chef because I haven't worked in restaurants for 25 years.
Mm-hmm.
Okay.
Yep.
People try to skip steps. People get taught, oh, here's the shortcut to wisdom. There is no shortcuts to wisdom. There is none.
Yeah.
I've talked to many gurus and some of the best practitioners in the world, and they're like, yeah, you can get knowledge or you can get experience. But in order to have wisdom, you have to have both. And that is if you can find a practitioner that has wisdom, you've hit the jackpot. They're unicorns. And that's
Mm.
why when people go see, like, say, they have this idea of just going to see a physio or a chiro, you're not, it's a luck of the draw. You could see
Oh
someone
yeah.
who's straight out of university or college, or
Mm-hmm.
you could see the greatest master of that is the best practitioner in the world and everything in between. So when people go see a practitioner, it's not like when you call up a plumber. I could call up 100 plumbers. 99 of them are going to be able to fix my toilet, right? I might have one idiot that has no clue, right? But if you call up 100 physios or 100 chiros or 100 osteos, it's going to be all over the place. You're going to have some that are amazing. You're going to have some that are okay. You're going to have some that are not so good. And you're going to have some that will actually make you worse.
Mm-hmm. Yeah.
And
I've
I've had
experienced
that
all of
many
that.
times. Yeah. Yeah.
Yeah.
And so I tell people, do a little bit of research before you just go see someone. Don't be like, oh, I'm going to go see a chiropractor. I'm going to go see a physio. Or people generalize. They go, oh, I heard my cousin got hurt by a chiropractor. So I'm never going to go see a chiropractor. That'd be the equivalent of me saying, oh, my cousin had a bad plumber once. So I'm never going to use a plumber. It makes no
Yeah, good
sense,
analogy. Yeah.
right? Instead of
Well,
going,
it does because humans experience fear. So I
yeah,
understand the thought pattern, but no,
yeah.
rationally,
Instead, what I
no.
tell people to do is well, your cousin saw one of the practitioners that we mentioned, one of the groups that actually made him worse.
Hmm.
That doesn't mean you can generalize the entire practice and
Right.
paint the whole practice with that broad stroke. It just means Bill, the guy he saw, was a shitty chiropractor.
Right.
There's
Right.
awesome chiropractors,
It
there's
happens.
crappy, there's everything in between.
Yeah. Yeah. I have experienced multiple practitioners in different realms of that. I'm curious when someone comes to you with pain, what does like the assessment look like for you to determine, yes, you can help them. No, I need to refer out. What is that process?
Yeah, so I spend an hour with patients on the first visit. So it entails a thorough history taking. They also fill out like a form before they come in that tells me, so I don't have to go through all the minutia of, how many alcoholic drinks do you have a week and how many coffees do you have and what's your diet and how many surgeries have you had and what medications are you on? But we go through all that because all that stuff's important. Um, but when I assess people, a lot of it's just the listening. That actually took me years to get good at. My patients tell me the answer. I just have to listen. Like
Mm.
90% of the time. I'm just like, after they talk to me for 10 minutes, I'm like, I know what's wrong with you.
Like what's an example of that? Like what would someone say where you can
Oh, well,
pinpoint
someone
what?
will come in. Okay, so I had a guy in the other day, and he had mid back pain, and he's like, when he was talking to me, he's like, "Oh, should I go see a massage therapist?" I think it's a rib because I have pain over it in the side of my back and stuff. And so I go through my history and, asking, have you had this problem before? And he's like, no, not really. And I'm like, what have you been doing lately? And he's like, oh, I've been, a bit more active. And oh, what did he say? He went on a big long road trip. So he'd been sitting in a car for hours and hours and hours. And I was like, okay. Um, so then I go through an orthopedic assessment. So I'll do some motion palpation. I'll do also some functional movement. So I'll just watch them move. And it's kind of funny when you get like the wisdom that I was talking about. I'm almost like Neo in the Matrix. So I watch people and I can I can see things. I'm like, yeah, that's not good. I'm like, that's not good.
Yeah.
And so
I know
I just watch them move.
Lauren experiences that too. Um,
Yeah,
when I'm with
yeah,
her, she's
yeah.
like
And that's
watching
and
how
that's
people walk and stand. I'm like, oh, I can't see any of that. It's amazing.
yeah. I can tell people walking from half a mile away. I can go, oh, that guy's got a hip problem on the right.
Wow.
And it's just from
Yeah.
experience. You see it 100,000 times and you get good at it. But what was the point I was going to make there? Oh, so
So you've been
so
sitting
then
in the
I
car.
do yeah, so I do orthopedic assessment, I do functional movement assessment, I do neurological assessment. So a lot of it is just ruling things out. I got to rule out all the nasty problems he could potentially have. And then I found he had a vertebra that was really stuck and quite tender. And I said to him, I go, I think it's just the vertebra here. I've seen this before. I said, the good news is if that's what it is, you get like instantaneous relief. And you think I'm a genius. So he goes, okay. And I said, if it's not, you will either feel no better or you might actually be a little bit worse. So part of it is I have to see. I'm not, if you said, Adam, would you bet your house on it? I'm like, no. I'm 95% sure, but there's still a little bit of playroom in there where it could be something else. Because I don't have X-ray vision and I can't see inside him. So he was like, okay, let's do it. So I adjusted that vertebra, and straight away he was like, oh my God, it feels like you took the rod out of my back. His rib pain went away. I called him the next day because I said, often with this, you only need one treatment. So I said, I'll call you tomorrow. You tell me how you're doing. And if it's still bothering you, we'll get you in for one more treatment. So I called him the next day and he's like, yeah, I'm perfect. He's like, I don't need to see it.
Wow.
But I was
Nice.
like, great.
That's the dream right there. That's
Yeah,
incredible.
well, yeah. Yeah, I look like a superhero when I do that but it was just more the condition. And I
Sure.
recognize that. And I told him, I'm like, look, if this is what you have, which I think is what you have, you will be good to go. But
Yeah.
other people, it's other problems, and I'll tell them. But I make a lot of it is also making people aware. You set the expectation, right? So if someone has, say, like a bulging disc in their neck, I'm going to tell them, look, this is going to take a little while. This isn't a one and done kind of thing. I need to work with your body because I also tell people I don't make the rules. I just know the rules. I'm like a referee. So I'll say, like, this problem usually takes, 2 to 4 weeks to resolve. Again, I don't make the rules. I just know them. So, because
Yeah.
some people are like, well, you're no good. You can't fix it in 1 or 2 visits. I'm like, nobody can.
Yeah. Yeah.
It's
Yeah.
it's
I
like
think
me
it's
giving you
always
a plant.
better. Yeah.
It's
Better
like
to
me giving you
under
a plant.
promise.
Yeah, it'd be like if I gave you a plant and said, if you water this every day for 6 months, you'll get a flower. And then after 2 weeks, you're like, I've been watering it twice a day and I'm not getting a flower. And I'm like,
That's
well,
not what you said.
that's not how shit works.
Yeah.
You know,
Yeah.
it's a laws of nature. You can't, because you're watering it twice won't make it go twice as fast,
Right.
right?
With any health journey, we have to be patient and listen to the practitioner and what they say. Most things are not going to be reversed overnight.
Yeah,
Yeah.
yeah. Well, there are things you can speed up. Like I tell people there's
Yeah.
3 ways to get better. One is stop doing the things that make it worse or aggravate the problem. Start doing things that make it better, stronger, more resilient, more stable, more strong. And three, get some body work done. Now, if you do all three together, you have a synergistic effect. right? I tell people 1 + 1 + 1 is 12.
Hmm.
All right, because they all work together. Because two of those things you can do totally by yourself, avoiding the things that irritate it and doing the things that make it better, right? So a lot of it is based on what patients do. So I go, that's great, because you don't need to see me to do those two things. You only need me for the third one. So if you do what I tell you to do, you will get better much, much faster than if you just rely on me to fix you.
Absolutely.
Right.
I believe in that
Homework.
synergy, and that can be in a positive direction or a negative, right? Because it's never one thing contributing, and it's never one thing that's going to get you better. I would love to use myself as a bit of a case study because I struggle a lot with the first one that you mentioned, which is stop doing the things that irritate it.
Yeah.
We have, again, a lot of wear and tear from dancing. So I have old injuries, and I think like micro adjustments and compensation patterns that I've developed over time because I'm an athlete and a dancer.
Yeah.
So that unwinding and stopping doing the things that are potentially creating my sensations of pain are very difficult to highlight.
Mm-hmm. Mm-hmm.
And so I'm in it for the long haul. Like, I believe pain is a teacher, it's a gift. I still have more lessons to be learned. But what about maybe for people that are more on the athletic side that we're very strong, but in maybe the wrong ways because we've been doing this for a long time.
Yeah, so with athletes, particularly highly competitive or elite athletes, you can almost go to the other end of the spectrum. So I'll be like, do these exercises twice a day, and they'll come back the next week and be like, I've been doing them 10 times a day. And I'm like, no.
Overachiever.
That's definitely not me, but I
Yeah.
recognize that.
Yeah, but I get
People.
them, and I'm like, there's a reason I tell you to do it twice a day because, you
Yeah.
know, it'd be like me saying, like, look, if you do 50 push-ups a day, it'll help, it'll get you stronger. And you're like, whoa, what if I do 1,000? And I'm like, well, you're gonna end up injured,
Yeah.
right? Because
Right.
it's an overuse thing. You're gonna damage the tissue, right? So again, there's always a sweet spot, right? So again, if we go back to that push-up analogy, if I tell you to do two push-ups, that's probably not going to move the needle a whole lot, right? So it's
Yeah.
always figuring out where the sweet spot is. And I think that's, again, where a lot of practitioners are kind of failing, is not working with the client to figure out where their sweet spot is. So I develop exercise programs for my clients. So I'll bring them into the gym and I'll actually give them a weight and be like, okay, try that. So let's say it's 10 pounds. And they go, oh, that's kind of easy. And then I go, okay, try 12 pounds. And then they go, oh, that's more challenging, but I can still do it. And then I give them 14 pounds and they're like, oh, that's too heavy. Right? So I found their sweet spot. I go, 12 pounds is what you need. Okay, but that's going to change. If you keep training in 2 or 3 weeks, 12 pounds is going to be too easy for you. And because the goalposts move as you get stronger, more resilient, more functional, right? So
Yeah.
in 3 weeks' time, I got to move them up to 14 pounds. And so we're always reassessing and figuring these things out. Whereas a lot of practitioners just like to go, here's your exercises, just do them, and that'll sort you out. And it's like, it's not that easy. It really isn't. You have to
Yeah.
continually progress. You always want to stay in the pocket,
Yeah.
always in that, not too hard, but not too easy.
But what about the
Goldilocks.
figuring out of the things that are making you worse? That's the piece that really puzzles me.
Yeah, so that can be difficult. But a lot of it, have you heard the term interoception?
Of
Mhm.
course.
Yeah. So for listeners, if you don't know what interoception is, it's basically tuning into your body. So it'd be like me saying, tell me how your right big toe feels right now. Tell me how your neck feels right now. Tell me how your left ear feels. And if you pay attention, you can zone into all these parts. And a lot of people we've kind of drifted away from doing that because we're all so busy. We're all focused on external things rather than internal things, right? So like it's like when people, you hear these stories of people getting like tumors and stuff that grow the size of footballs. And it's like, how did you not feel that growing inside you, or could you not feel all the signs and symptoms that were accompanying that? That really shows me that someone had no interoception whatsoever, right? Because they just ignored all these signs and symptoms. So that's really important. So I work with patients to get them to work on their interoception. I'll be like, every day I want you to do like a body scan and check in with all these spots and see how they feel. But there's also the component of a lot of people, especially type A people, they're always hard charging. It's like, I'm going hard no matter what. It doesn't matter if it's a Sunday. I still, it's go hard or go home. And I'm like, that does not work. Your body's running the show. You can't just be like, you're going to do what I tell you because I'm the boss. It just laughs at you and goes, yeah, okay. We'll see how that works out for you. And then it
Yeah.
knocks you on your ass and then you end up sick or injured or whatever. Okay? So what I tell people a lot is you just got to listen to your body. Your body tells you the answer. Because I get that a lot from patients. They'll be like, should I do this? And I'm like, I don't know. I'm like, ask your body. I said,
Yeah.
go try it. They're like, can I go for a run? And I'm like, well, try like a short run and see how you feel. If you feel good during, immediately after, and the next day, then it was fine. So that's a caveat there. Because sometimes people feel okay while they're doing it.
Mhm.
So like tendinopathy, for instance. So like if a runner had Achilles tendinopathy, they actually feel better when they're running because it
Mhm.
warms up and it feels good. But the next day, that's when they pay the price. They'll wake up and they can hardly walk. So that's
Yikes.
why I say during, after, or the next day.
Mhm.
Yeah, yeah. I'm reading this book right now called When the Body Says No. I don't know if you've
Yeah.
read it. Yeah.
Oh no, I should look that
It's
up.
yeah, it's really good. I'm like more than halfway through it, but a lot of what you're saying, like when you're not listening to your body and you're just kind of overriding any pain or symptoms and not tuning in, eventually you'll get some kind of disease or major injury or something. It's a
Yeah,
really good
again,
book, but
it's a warning system. It's like a
yeah,
smoke alarm. You don't just go and break the smoke alarm and be like, "Oh, solve that one."
yeah,
It's maybe
yeah,
look for smoke first
yeah.
before
We
before
got
you
to
turn
tune
on the
in.
smoke
We got to
alarm.
tune in. Yeah. Well,
Yeah, yeah.
I I would love to talk about the tech that you've discovered. Is that okay if we jump into that?
Yeah,
Because
yeah, let's do it.
I was just blown away when I first experienced it because I've had this chronic neck and like upper shoulder back kind of pain, and
Mhm.
I've done chiropractic, massage, acupuncture, and I'll get a little bit of relief for a little bit, and then it comes right back. And I haven't really solved that equation. But then I did
Yeah.
a Wasabi Method session.
Mhm.
And I think the first time I want to say I did like maybe 5 minutes and then I came back an hour later and did like another 5 minute session. And
Was that when we were in Las Vegas?
that was in at the Health Span Summit in LA. Where Adam,
Oh, okay. Okay.
I don't think
I
you were at
wasn't
that
there.
one. Yeah.
I wasn't there.
Um, not only did I have absolutely zero pain, like all of the pain was gone, what I
Mhm.
was even more blown away by was the range of motion. Like
Mhm.
I could circle my arms in a way that I don't think I've done in 20 years. It
Yeah.
was wild. And then the pain, I had no pain for at least 2 days after that, like zero pain.
Mhm.
Um, and I sometimes with the pain, I wake up in the middle of the night and then I'm like, oh, I can't get comfortable. And that's the worst when you can't sleep because of the pain. That's so frustrating. So I
Yeah.
slept so well that week after the session. Um,
Oh, great.
but so, anyways, I'll shut up about my experience. It was just so amazing. But let's talk about the technology. What is Wasabi Method and how does this work in the body?
Yeah, so Wasabi Method it falls under the category of shockwave therapy. Now, with our device, it doesn't quite meet the definition of a shockwave because it has to get up to 100 millipascals of pressure, and ours doesn't. But so we call it radial pressure waves. So again, there's a therapeutic window at which so they're essentially sound waves. So imagine, I'm going on with all these analogies, but
I
imagine
like
you stood in
analogies.
front, and imagine you stood in front of a big gong, like one of those Chinese, you know, huge gongs, and I hit it really hard, and you would feel those sound waves hit your body, yeah?
Hmm.
Or like if you stand in front of like a subwoofer and at a concert, you can feel it hitting you. So at certain energy levels, sound creates physiological changes on the tissues they encounter. So I tell people it's like me telling the body, clean up on aisle five. And then your body releases all these chemicals and enzymes and growth factors to heal that area, which is really fascinating because you could say you hurt your elbow like 20 years ago. It doesn't matter. I can still tell your body clean up on aisle five, and it will still go in there and clean up the damage that you did 20 years ago. So, which is really
Wow.
fascinating because a lot of treatments they won't be able to do that. So they're
Yeah.
acoustic sound waves, and we have to use like ultrasound gel because sound you lose all the energy through air. So we have to put a bit of contact gel so it goes into the tissues. And with our device, you get to almost 2 inches of penetration with certain tips. So we have different size tips. So we have wider ones and more narrow ones. The narrower ones give you a little bit deeper penetration, and the wider ones, their work a little more superficial. So it depends on what muscle I'm working. So if someone's just got a superficial muscle that I need to work on, I can use one of the wider ones. Or if they have a deeper muscle that I need to get to, I'll use one of the narrower tips.
And
Can you use this on any area of the body? So you said muscles, but you can do
Yeah.
tendons, like basically any tissues.
Yeah, there are a few contraindications. You can't use it over the lungs. So because of the sound waves cause air-filled organs to expand.
Mm.
So
oh,
there is a risk that I could damage your lung. It's very low, but we just tell people to avoid it if they can.
Hmm.
Other things like clearly you wouldn't put it on your eyeball. Um, you
that
you can
doesn't sound
actually do it
fun.
on you can actually do it on your face. So there's cosmetic and aesthetic benefits because it causes the proliferation of collagen. It also stimulates stem cells. And one of the big ones is it causes what's called angiogenesis, which is the new formation of blood vessels. So a lot of the problems that we have in our body is due to a lack of blood flow. So if we go back to another analogy, it's like think of your skin and your tissues as like a plant. If I give that plant adequate water, it thrives and grows. Now, a lot of spots that we have, either skin conditions or damage. So say you had like a scar um, from an injury or surgery, that restricts it. It changes the blood flow to that area. So I can change that in a permanent manner with our device. So whereas a lot of treatments and a lot of modalities, they're temporary. So say if I put heat on your elbow, it will temporarily cause a vasodilation of those blood vessels and you'll have an influx of blood to that area. But as soon as you take the heat away, that's gone. So
Mm.
with this, we cause the proliferation of a growth factor called VEGF. It stands for vascular endothelial growth factor. So that's like fertilizer for your blood vessels. It tells your body, if I do it right on your elbow, it'll cause your body to grow and lay down new blood vessels in that area. So again, that will really help the blood flow to all those tissues, and those tissues begin to heal and repair just naturally.
Right,
So not
right.
just pain relief, but pain prevention, and we could use it proactively in any area.
Yeah, yeah. Well, it causes tissue repair, it causes tissue recovery. You actually get like there's so many things. People don't believe me when I tell them all the benefits because it's almost unbelievable. But like I said, so you get stem cells, it causes proliferation of stem cells. You get proliferation of collagen. It causes neurogenesis. So actually, if you have peripheral neuropathy, I can actually help with that. So it will grow. I'm telling the nerves, just like with the blood vessels, I tell the nerves to grow and expand. So if you have some, nerve damage to a small degree, we can actually help with that. So someone who has, the beginnings of, diabetic neuropathy, we can help with that.
Mm-hmm.
But that's in two ways. So
Cool.
we help the blood flow and we help the nerves. Other things we help with tendons, we cause a proliferation of what are called tenocytes. They're the cells that actually make new tendon. We cause tendons also to release a lubricant called lubricin, which makes them slide and glide much easier. Other ones we cause neovascularization, which is the new formation of veins. And it also gives you a local analgesic effect, which is really cool. And that's what you guys were noticing with the pain.
Mm-hmm.
Oh,
So I
yeah.
stimulate the nerve endings in the area. They release a compound called substance P. So if you've ever eaten like a hot pepper, it's the same mechanism. So your mouth kind of burns and hurts, and then after a while it kind of goes numb.
Yeah.
Like I
And you
can't taste
cry a
anything.
little bit, but we don't
Yeah.
cry with this one. Not with
Yeah.
wasabi.
Well, we call it wasabi because it's a bit spicy when
Yeah.
when you get treatment.
Yeah, it is. It's like, like it hurts so good kind of thing. Like when I go get a
Yeah, yeah,
massage, I'm like, yeah, dig your elbow in there, like
yeah,
stand on my back. Like I like the pain because it feels so therapeutic, and that's how I would explain wasabi. And I know
yeah,
you said, Adam, like you could, if it's really uncomfortable for people, you can always turn it down. You
yeah.
just maybe won't get the fastest result versus maybe turning it up. You feel it more, you would see a faster result, correct?
Yeah, well, when we turn it up, we're essentially increasing the energy, and
Okay.
there's kind of the higher energy you go, the greater the therapeutic effect, right?
Right.
But I always do it based on patient tolerance. So, I always make jokes when I teach seminars that if your patient's crying and spitting up blood, you're going too hard.
Oh God.
Oh my gosh. Okay.
Too much, too much.
Yeah, but in most cases, like more is not better, but the
No,
intensity
and
here is
that's what I'm
actually,
saying. So like
yeah,
you'll get these athletes that are like, I can take it, I can take it. I'm like,
You don't need
if
to.
I go in too hard, I can actually damage the tissue.
Mm.
yeah.
So so you have to work. That's why we work on patient feedback. So I tell people if it needs to be below a 7 out of 10 on your pain scale. If it exceeds a 7, I need to turn it down or work on a different spot.
And that's their perception, not yours.
Yeah, yeah,
The
yeah,
perception
yeah,
of heaven.
yeah. So my patients guide me. I
Mm.
don't sit there and go suck it up and
Yeah.
you're being a wimp or something. I just go, you guide me. You tell me what you can handle.
Yeah.
Got it.
Yeah.
So for anyone that wants to maybe try this,
Hmm.
as
Hmm.
everyone should,
Yeah,
we're doing this podcast to spread the word because we want to get more of these in the
yeah,
United States. So
yeah.
maybe for practitioners that are listening that would maybe want to incorporate this would be like chiropractors, physical therapists, like who else would want to add this to their practice?
Yeah, really, really any medical practitioner or allied health practitioner. So whether it's a nurse, one thing I failed to mention is it actually helps with wounds. So if someone has a wound that won't heal, even if it's like a bacterial infection, like I've got a study with this 90-year-old man and he had a golden staph infection in his arm and he couldn't take antibiotics and they treated him every day with the shockwave because it's antibacterial. And after a week, his gold staph infection was totally gone.
Covered
Wow.
though. Yes.
Sorry?
It's covered when you use it.
Yeah, yeah. You can basically put like cling wrap on it,
Yeah.
and then yeah, and then you can treat it. So there's that. You can treat burn victims. Yeah,
Yeah.
it's really fascinating. Like again, people don't believe me, and then I send them the studies, and they're like, "Oh my God."
Yeah.
That's
And it
wild.
can actually help with non-union fractures. So people that have bones that won't knit together, because it stimulates what are called osteoblasts, and they're bone cells that create more bone.
Hmm.
And it actually inhibits osteoclasts. So osteoclasts are the bone cells that destroy old, decrepit bone. So
Right.
normally in a normal bone, the level at which bones being laid down and the level at which bones being broken are equal. But if someone has increased levels of osteoclastic activity, then all of a sudden they're breaking down more bone than being laid down, and then you end up with things like osteoporosis or osteopenia.
So
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 could
I
this be
re
used?
then like a Prolia injection, this would actually be better for preventing the bone
Yeah,
break.
it's better because it's natural.
Yeah.
It's not
Right.
exogenous. It's not a foreign. I'm telling your body, make more osteoblasts, make less osteoclasts. But the really cool thing I
Right.
didn't know about, because I went on a podcast with a practitioner who's involved with osteoporosis, it actually has a systemic effect. So I can treat your left leg and have it affect your entire body because it has a systemic effect.
Cool.
Oh, okay. That's cool. I was wondering if you had to do like the whole body, like how long would
No,
that take?
no,
Okay.
no. It's kind of like working out. If I do arm curls, I don't just get testosterone and growth hormone in my arm, do I?
Right.
Yeah.
Right? It's the
Yeah.
whole body.
Yeah.
So it's a
Systemic.
Yeah.
similar thing.
This is like a magic wand. You're like Harry Potter.
Yeah,
This is very cool.
yeah,
Harry
yeah,
Potter.
that's why I got into this about 16 years ago. Is I just was like, wow, it does all these wonderful things. It's non-invasive. It's super safe. That's the other thing. It's relatively new in the United States because FDA had really stringent rules against it. But here in Australia, we've been using it for over 30 years.
Hmm.
So
Oh,
there's
wow.
tons of research. So when people are like, "Is it safe?" I'm like, "Here's like 1,000 studies." Because like
Yeah.
I've gone through the literature because I used to teach for one of the biggest shockwave companies in the world, and I had to know this stuff because I always got put in front of top researchers and orthopedic surgeons and neurosurgeons, and they always ask the hard questions. So I had to always
Oh,
be
yeah.
on top of the research.
You did your homework.
Yeah.
Yes.
Yeah.
Mhm.
So, for non-practitioners, for people that want to experience this, you have a list of practitioners on the Wasabi website.
Yes.
Anything else that people should know about how to find this? And because I just think the
Yeah,
magic is
well,
the
the
practitioner
other
with the device.
yeah, the other thing I didn't mention is that we actually sell to non-medical. So like I could sell to you, Lauren or Renee, if you guys wanted one. The caveat there is you're only allowed to treat yourself. Because if you don't have a license to touch and you don't have insurance, then if you harm someone, they could sue you and you could lose everything. So I tell
Right.
people, don't do that.
Yeah.
We won't, I actually won't even give you the device until you pass our safety course. So if
Mhm.
you want to buy a device, you send in that you want to buy one, you make the payment. I send you the safety module. You actually have to pass the module before I'll send you the device.
That's great.
So it's
Smart.
a way of ensuring that people, have actually done the course and don't go and hurt someone. But that's
Mhm.
not only for your safety, but also the safety of the masses. I don't want people out
Yeah.
there hurting people because you
Oh, yeah.
can it's hard, but it is possible to harm people.
Mhm.
Yeah.
Yeah, I appreciate
Yeah.
that
Yeah.
disclaimer. Thank you. Very
Yeah.
cool.
But that's a cool thing. A lot of the company I used to work for, one of the biggest in the world, even though they're allowed to sell to non-medical, they refuse to.
Hmm.
So
And
that's where
is that like the shockwave that does more like the sexual rejuvenation stuff? Is that
no,
the
ours does that. Ours does that.
oh, right.
They have this attitude that we don't sell to peasants.
I mean, in some
They
ways, I
have this,
understand it's an art form, right? And you really want to keep the art form preserved and
yeah,
make
yeah.
sure
But
that no one's
Yeah.
like
bastardizing it.
I feel like we didn't mention that my partner is Dave Asprey. So we're co-founders in the business, and we really felt like that's kind of we almost feel like we're Prometheus stealing fire from the gods and giving it to the people because we're like, why can't people have this technology?
Hmm.
It's safe, it's effective, and there's
Yeah.
no, and it's legal. The FDA deems it okay. It's a class 1 device.
Hmm.
So,
Yeah.
you know,
Yeah.
But the way that we're doing it is when you buy, if you're non-medical, if you buy the device, you also have to buy our education. So that's another layer of protection. So we're going to teach you exactly what to do. And that's why we call it Wasabi Method, because it's not just the device, it's learning how to use the device.
Of course.
So no other company has the level of education that we do. We have 5 modules. One is the upper body, one is lower body, one is men's sexual health, one is women's sexual health, and then we have advanced techniques. So that's like when we talk about like the burn victims, the wound healing, the non-union fractures, lymphedema, cellulite. We can actually treat cellulite with that. So
Oh,
yeah.
wow.
That's a
Hmm.
good buzzword for people to hear. Very cool.
Yeah,
Yeah.
Yeah,
yeah.
so
I'm
if
trying to
people want
remember all
to,
the things I'm supposed to mention.
oh, endless. Well, people can go to your website,
Mhm.
wasabimethod.com, right? There's more resources on there. If they're a practitioner, they can
Yeah.
take the next step. If they want to get the course and purchase, that's all on the website, correct?
Mhm.
Okay.
Yep. And we're on Instagram as well at wasabi_method. So I try and post on there, and it'd be great if people can follow us. And
I think there's a video of me on your page. I'll have to see.
yeah,
Oh, yeah.
I'll link to it in the show notes if I can find it on
yeah,
Instagram.
yeah, yeah. If it's not, I can put one. I can put one up.
Yeah, so you can
I still
see
have a
how.
video I'm holding on to that will be posted at some point.
Okay.
Oh,
Probably when
maybe
Yeah,
when
I
we're
this
couldn't find.
comes out.
I was looking for one when I treated you in eudaimonia, Lauren. I
I
couldn't
have
find it.
it. Where
Okay.
Uh,
it's gonna be
Okay.
released. Watch out.
All right. All right.
okay,
Yeah.
awesome.
Well, thank you so much, Adam. This is awesome.
Yeah.
We love wasabi and just so happy to share this with everyone.
Yeah, I'm happy to share. Thank you so much for having me on and spreading the word. It's it's kind of humbling when I go to these conferences and stuff and I get some of the reactions that we get, like you guys were saying. Some of these people are, they're like, "Oh my God, I've had this problem for years, and you basically got rid of it in one treatment." And it's I feel bad in the way that it's like, what were these other practitioners doing, like, and because I want, and that's why we do the education. So I don't want to be the only guy in the world that can do this stuff.
Yeah.
I want to disseminate my wisdom so that everyone can do this, so that, because I can only treat so many people a day or a week. But
Mhm.
if I train
Yeah,
an army of practitioners, then we're helping, so many more people, and that's what people deserve, because we don't need to be using pills, needles, and scalpels to fix everything. It's not the way it should be done. Those should always
yeah,
be the last thing we try. There's
Mhm.
many other things we can do before you have to get, injections or do surgery.
Yeah, I agree.
absolutely. Yeah.
Yeah. Well, thank
Well,
you.
yeah. So excited about this.
We would
Sorry, go
love to
ahead, Lauren.
ask just one final piece of advice. If you could share one piece of wisdom with our
Oh,
audience
wow.
today, something they can start doing today
Well, you
to
put me
improve their
on the
health.
spot now.
Yeah, that's the point.
Watch
It's
me
See
whatever
what your
comes
squirm.
to you.
see what your favorite thing is. Just
Oh, do you mean just like as a biohack or specifically to wasabi?
It is anything that comes to your mind that can improve someone's health. It's an actionable that they could start today before they look into wasabi, even. Or it could
yeah.
just be go to the website.
Yeah.
Yeah, well, it's I think like a good thing is find a either a good practitioner or some kind of mentor, that can help you, that can help guide you. It's I'm going to do one more analogy for you. It'd be like you
Yes.
climbing, Mount Everest by yourself, right? You're going to make so many mistakes, and you might
Yeah.
hurt
Yeah.
yourself or die.
I
Okay,
don't think
Don't
you're
like
even
that's
allowed
extreme.
to, but if you wiggled your way in, yeah.
But
Yeah.
if you research and you find like the best Sherpa in the world that's done it, 100 times, then you're going to go so much better. And it makes so much more sense to have someone with that wisdom and experience to help guide you. And that's what I recommend for everyone to get. Find it doesn't have to be the best, I think people get stuck on that, I know some practitioners that are amazing that no one's ever heard of. You don't have to go pay the, top gurus in the world who want, thousands of dollars for a consultation. You don't need that. Just do some research, ask your friends, ask your family, and go try a few people, and you'll find someone that you connect with, resonate with, and just do what they say. Like I have that with some of my patients. I'm like, please just do what I say and you will get better. I almost challenge them. It's like, prove me wrong. It's like, do everything I say, and if you don't get better, I'll give you your money back.
Yeah. No,
There you
That's how
go.
confident I
There you
am.
go. Yeah.
mhm.
You know, um,
I mean,
there's
that's
very,
how doctors used to be paid. So I hear way back in the day is
oh wow, I didn't
when the
know that.
patients would get well, that's when the doctors would get paid.
Oh,
Yeah,
wow.
they flip that around now. It's almost like keep them sick and then you make more money,
Yep.
Yeah.
right?
It's
Because
changed a lot.
if I gotta, if you have high blood pressure for the rest of your life, then you got to keep coming back to me, right? So you don't die.
Yep.
But if I fix your blood pressure permanently, then you don't need me anymore, right?
Right. That's how it should be.
Oh gosh, I
Yeah.
feel like I want to
Okay.
tell a story, but it's not. Oh,
Yeah,
I'll screw you off
yeah.
there. Just
Because we can
terrible,
go on a
terrible
big,
things.
big tangent with that
Yeah,
one,
we could
eh?
go on a big tangent. We're gonna just. Yeah.
All right, we'll wrap it up then.
Thank you so
But
much,
Okay.
yeah,
Adam.
I encourage people to take ownership of their own health. Don't rely on other people to do it for you. You're the captain of your own ship.
Yes.
Guide it, become informed. Don't rely on other people to do the work for you. Knowledge is power. So just keep learning. Things like what you guys are doing with these podcasts is fantastic. You get people that are knowledgeable, have wisdom, and are willing to share, and it's free.
Yeah,
Like
it's
that's
free.
Yeah.
that's so incredible that we have these opportunities nowadays.
Yeah.
We didn't have these when we were young, so it's
Yeah.
awesome.
Yeah.
I
Thank you.
I
All at our
appreciate you guys.
fingertips. There's no excuse now to not be educating yourself and
Yeah.
Exactly.
Yeah.
yeah.
So I
Thank
want
you
to
so
thank you
much.
guys for what you guys do and spreading the word, and it's wonderful. I appreciate you guys.
Thank
Oh,
you.
right back
Likewise.
at you. Thanks,
Thank
Adam,
you.
for spending your time with us.
You're
This is
welcome.
awesome.
And thanks to everyone for tuning in. We'll see you next time.